Good morning. This is Dr. McDaniel. I'm a board certified obstetrician gynecologist in New York City, and I'm bringing to you all things health related for women. Thank you for joining me at the corner today. I thought I'd just pop out a quick presentation. I'm at the horse farm. It's a little bit nicer today than it's been the last couple of weeks, but of course I do have allergies, so I might sneeze a few times, excuse me in advance. But let's see. I thought I'd do this presentation on the fear of pain, and that's with respect to the IUD insertion, because I've been doing quite a few IUDs recently, and almost every single patient before the appointment for the insertion expresses to me how worried or concerned or her anxiety about the pain. So as I like to say to the patients, I say there's nothing to fear but fear itself, in the words of FDR. But the reality is, as I do tell people, the reality is that the IUD insertion is quite painful, and that's because we have to stretch or dilate the cervix in order to get the trocar that contains the IUD into the uterus. And it's the stretching or the dilatation of the cervix that causes all the pain. It feels like super duper uber strong menstrual cramps, or a little soupçon, a little hint or a taste of labor pains, because it's a dilation of the cervix, which of course is what happens during labor. And then that dilatation also causes contractions or spasming or cramping of the uterus itself. So it can be, for some people who aren't used to have an errant hair there, for some people who aren't used to cramps with their menstrual cycles, it can be extremely painful for them. If you're used to cramps with the menstrual cycles, it'll still be painful because there's lots of cramping, but it won't be as horrible as it may have as it may feel if you're not used to dealing with cramps or with pain at all. So there are a few ways to address or to manage or to mitigate, decrease, prevent the pain as much as possible. I've been placing IUDs since 1993, so this is 2022, so 29 years now I've been placing IUDs. And around 2000, I feel like it was around 2004 or so, I realized I was doing bigger procedures and people were having as much flip outs about the pain, writhing, or lots of groaning and moaning. And it's not just stressful for the patient, it's stressful for me too. If I'm in the room doing a procedure and they're moaning, groaning, or grunting, having issues with all the pain. So what I realized is the larger procedures I was doing, I always gave an anesthetic and pain medicine beforehand. Now, when we trained to place an IUD in residency at least 30 years ago, and I'm pretty sure now, because I'm not aware of of anyone else who's doing preventative pain management for IUDs. When we train, we're not trained to place pain medicine or to do anything for the pain, because the dilatation and the insertion are quite quick. So in general, barring any issues or complications, it takes maybe 4 minutes to place an IUD, so it's pretty quick. And especially if you don't place the IUD on demand, you place it with the menstrual cycle. Placing it with the menstrual cycle is super important for two reasons. One, the person's not pregnant if they're on their menstrual cycle, and there have been a lot of cases over the last several years where people are placing it on demand, getting a quick pregnancy test before they place the IUD, and then of course the patient was pregnant, but the pregnancy was so early that the urine pregnancy test didn't pick it up. So placing it with the menstrual cycle, one, there's no issue about pregnancy unawares. And then two, the cervix is always a little softer, it's more pliable. The dilatation process for the IUD is much faster because the cervix dilates and stretches open much faster when a woman's on her menstrual cycle than when she's not. So I always place the IUD with the menstrual cycle because it's faster. And sometimes with the menstrual cycle, it's not like 3 or 4 minutes for the whole process. It's like 2 minutes. It can be very quick. And then I realized that the larger procedures, I was pre-medicating and giving a cervical blocker and anesthetic. So I started doing that with my IUDs. So since 2004, I haven't had anyone saying that the IUD placements are painful. I've had a lot of people say it's a lot of pressure or discomfort, or it feels like a little bit like a menstrual cramp. Uh, but mostly they're just super anxious beforehand, and then when we finish, they're shocked. They're like, wow, that was easy. I've actually had patients who have said, oh my God, the IUD's in, I didn't even feel it. So that, for some reason, I always take that as a compliment, even though it's not under my control how well her body responds to the anesthetic. I still take it as a compliment. Good. So what I always do is I have everyone take whatever their painkiller of choice is for cramps, headaches, back, it doesn't matter. Advil, Motrin, ibuprofen, as long as it's not aspirin, because of course aspirin will potentially increase bleeding. So take their pain medication of choice an hour before they come in and bring it with them to take afterwards, because the uterus will spasm even if they're not having a lot of pain. It will spasm after the newly placed IUD. And then I give everyone a cervical block with lidocaine. So the lidocaine will decrease the sensation of the dilatation, and that's where 85-90% of the pain is coming from. It's coming from the actual stretching of the cervix. So when those nerves are numbed up, the stretching of the cervix isn't felt, and the response from that stretching, which is of course all of the uterine contractions, is minimized. So I give everyone a cervical block with lidocaine, have them take their pain medicine beforehand, also place the IUD with the menstrual cycle, and immediately it was like turning off a fountain. What do you call those? A fountain, or a spout, a water spout, or flipping off the light in a room. Boom! Immediately, no more screaming, moaning, groaning, no more complaints of horrible pain or stop, I can't do this. Makes a huge difference. So I guess if you're in the tri-state area, you can always come to me, Dr. McDaniel, for the IUD placement, or you can make sure that your IUD placement, regardless of the doctor who does it, is during the menstrual cycle, that you take pain medicine before, and then if they're comfortable, because obviously you don't want to try to force someone to do something they're not comfortable with. That's when you're going to have a problem or a complication. If they're comfortable, ask them if they can place a cervical block for you, and if they know how and they can, then you're not going to have any issues with pain. Never assume that every single doctor knows how to do what they're expected to do. You always have to find out. So I hope that's been helpful information on the fear of pain. This is Dr. McDaniel. Thank you for joining me at GYN Corner. Make sure you click the like, subscribe, follow buttons, click the bell for the notifications so you know when these presentations are coming out. I'm on Facebook, YouTube, all of the platforms for the podcast. And make sure you place a message, comments in the bottom if you like the content, if you want more, or if you have questions, and I'll be more than happy to address the questions on a future presentation. Have a great rest of your day. Bye.